Okay, so when looking at the movements of the shoulder and the hip, we can start to duplicate some of the movements, and it can be quite a useful tool to do that to help us remember which movements occur at which joints. So the shoulder joint is a ball and socket joint, and the hip joint is a ball and socket joint, so you get very similar movements. A good way to start remembering the movements is, what movement is this at the hip? Now, hopefully, you'll be thinking hip flexion. Most people remember that as it's using the hip flexors. So if this is flexion of the hip, then if we do a similar movement in the shoulder, then that is also flexion of the shoulder. The opposite to flexion is extension. So if we were to bring our leg down, either from this flex position to there, that would be extension. Or if we were to continue that, that would also be extension. Again, if our arm is in this position, so it's in flexion, we bring it down using extension. And if we were to continue that, then again, that would be going into extension. So we've got flexion and extension. If we take our limb outwards, so if we either raise our arm to the side or we pick our leg out to the side, that would be called abduction, so abduction. A good way to remember that would be, if you think of when aliens take you away from the planet, they are abducting you, then that's what you're doing with your arm and your leg. You are abducting, or you've been abducted. So your arm and your leg is going away. And then when you bring that in, you are adding to your body, so that is adduction. If you were to do those four movements together, so you were to go through abduction, flexion, adduction, and extension, with some type of fluidity, then you're starting to look at a movement called circumduction. So circumduction, there's no rotation going on. It's kind of those four movements being done in a fluid manner, and it's not rotation, as rotation would include the actual either outwards or inwards rotation, which is what we're going to look at next. So we've got flexion, extension, abduction, adduction, and then circumduction. If we were to go through rotation, if you were to hold your arm out straight with your thumb up and rotate your arm outwards, that would be lateral rotation. So lateral means the outside of the body, and that would be lateral rotation. Or if you were to rotate your arm inwards, that would be medial rotation. Now, your arm doesn't need to be in this position. It's just quite clear which way you're going. If you put your arm more in a neutral position and you were to rotate your thumb outwards, that would be lateral rotation. Or if you were to rotate it inwards, that would be medial rotation. It is important to recognize that that movement's coming from the shoulder joint. So it's coming from your high up, and it's not coming from your wrist, as that's a different movement that we'd be looking at later. So it's the whole of the arm occurring from the shoulder joint. So lateral rotation and medial rotation. And you can get the same movement in your hip joint again, where it will be either lateral rotation or medial rotation. So those 7 movements are the only movements that can occur at the hip joint. So you've got flexion, extension, abduction, adduction, circumduction, lateral rotation, and medial rotation. The same 7 occur at the shoulder, but there's 2 more as well. So the extra 2 would be, a good way to remember it again would be if you hold your hands out in a line. That is a horizontal line, not a vertical line. So we go for horizontal flexion and horizontal extension. A good way to remember that again is the angle. So we spoke earlier about flexion. Generally, it means that the angle, the joint of the angle is getting smaller. So the joint of this angle is getting smaller, and then it's opening. So that's horizontal flexion, horizontal extension. So in the shoulder joint, you can have flexion, extension, abduction, adduction, circumduction, lateral rotation, medial rotation, and then horizontal flexion and horizontal extension.